Hello, Namaste. I welcome you all to this session on Gurukula. Today we have with us Dr. Rashmi Manjunath, who will be talking about stress management made easy. Dr. Rashmi Manjunath is the founder of Parivartan Ayur Yoga Wellness Center. Let me explain a little bit of bio about Dr. Rashmi Manjunath. First of all, this session is brought to you by easyayurveda.com. I dedicate this and all of my work to the holy feet of Dr. A. Chandrasekhar Udupa. This class is made live exclusively for weekly class subscribers of Easy Ayurveda. So cordial welcome to Dr. Rashmi MN to Easy Ayurveda family. So to tell about a brief regarding Dr. Rashmi Manjunath, her qualification is BAMS, and then she has done her post-graduation in Kaumara Bhrutya, that is Ayurvedic Pediatrics. And then she has also done a post-graduation diploma in yoga therapy for doctors. Then she is an Ayurveda practitioner. She has completed BAMS from Taranath Government Ayurvedic Medical College, Bellary, and Doctor of Medicine, that is post-graduation EMD in Kaumara Bhrutya from Alvas Ayurveda Medical College. She has treated many patients at Parivartan Ayur Yoga Wellness Center, including those suffering from diabetes, psoriasis, autoimmune disorders, lifestyle disorders, etc. She specializes in Panchakarma therapy. Coming to yoga profile of Dr. Rashmi, she is a yoga practitioner for over 20 years now. She has completed yoga instructor course and a PG diploma in yoga therapy from Swami Vivekananda Yoga Anusandhan Samsthan, Bengaluru. She has expertise in yoga, pranic healing, cupping therapy, neonatal resuscitation, sound ball healing, and aerial yoga. She has trained over 5,000 yoga practitioners for the past 12 years at Parivartan Ayur Yoga Wellness Center. She has trained over 40 aspiring yoga trainers through their yoga teaching training course as a certified level 1 yoga protocol instructor through the Yoga Certification Board under Ministry of Ayush, Government of India. She promotes practice of Astanga Yoga, Pranayama, Pranic Healing, and meditation. She conducts free yoga sessions for cancer survivors since 2 years at ACT REC Tata Memorial Hospital, Kharghar, Navi Mumbai. So we have today with us a dynamic personality who excels not only in Ayurveda and Panchakarma, but also in yoga. I cordially welcome all the participants to this session. And on behalf of us, all of us, I cordially welcome Dr. Rashmi Manjunath to this session. Good evening, ma'am.
Thank you. Thank you so much, sir. Before starting, so what I'm going to do today is Parichaya, Prashamana, and Parivartana. Parichaya is like introduction to a stress, or we can say just to understand where we are in this stress zone. And second is what are the coping strategies, or which coping strategy suits for me or suits my patient. And next is Parivartana. After adopting those strategies and skills, how I can change myself to a better version of myself. So this is how I'm going to do this presentation. Now, I will tell you the definition. Stress is a non-specific, conventional, and phylogenetic basic response. Okay, if I tell in this manner, maybe it will not be so conventional. So what I will do is give you one example. Imagine that you are sitting in an auditorium with a full of audience, and suddenly a snake came in between. Okay, just a snake came in between. So what is your immediate response for it? So somebody may jump, somebody may go away, somebody may run, somebody may just shock and still, and somebody may sit on the chair, and somebody may call the snake catcher and do the needful for the situation. So everybody's situation is same. Everybody's response is different, right? So everybody respond non-specific. Everybody's response is not specific, and it is more convenient if the person's upbringing is more of mixed with fear, lot of stressful, or maybe education is less, or lots of financial issues are there, or already the sattva is less. Then he may be shocked, or whose sattva is more, he may respond in a very different way. That is, means it's a conventional and phylogenetic. It's very specific to that person. So this is how the pattern comes out. That means stress is a response to the situation. Here, the snake is a situation, and your response to that snake is a stress. So this has clarified that what is a stress. That means that your financial burden, your family burden, your environmental burden, your physiological burden is a situation, but how you react to that situation is a stress. So stress comes from inside. It will not come from outside. So if it comes from inside, from us, that means that can be changed, right? So stress occurs when the pressure is greater than the resource. So this you might have noticed many times. So then, after understanding what is stress, that let's move on to the sources of the stress. These are the main four sources, like environment, social stressors, and physiological, and the thoughts. Most common is like what if you analyze your day since morning to night, then environmental also becomes a major source of stress. And social stressors are deadlines, problems, job interview, loss of loved ones, demands for your time and attention. These are a source for the stress. Then physiological sources are menopause, aging, lack of exercise, poor nutrition, inadequate sleep. If in yogic way, if I tell chitta rutti nirodha is a yoga. So chitta ruttis are considered as a overthinking or a thought process, which is a source or where the stress starts out, or where the reaction to the situation starts out. So this is the brain interrupts the complex changes in your environment, and the body determines when to start the emergency response. So what are the responses that you notice? See, this is what happens, right? When you see the snake in the very silent auditorium, what first response is alertness, and your heart rate goes up, and blood pressure goes up, and you take a gasping breathing, and muscle is tight, and digestive system says, okay, no, this is a time to give an emergency response. Okay, I'll not digest my food. So eyes becomes widened, and you start sweating. So this is a usual stress responses. So I can say, okay, every day we don't find a snake. I'll switch another example for you. Okay, if you get up in the morning late and you have a bus at 7 o'clock and you need 10 minutes to reach your bus stand, but you have only 5 minutes in hand, what you do? You can't say, oh, I don't want to take stress, I walk slowly. You can't do that, right? So you'll run to catch the bus. So when you start, like when the body starts, determines when to turn the emergency response, it start reacting to start the emergency response. And what happens? You run, so the heart rate increase, the blood pressure a little bit, and the muscle tone differs, and the digestive system saying you just had a breakfast, but you have to run for the bus. That means digestive system is on hold for some time. That's how the stress response happens. Just imagine that this is what happens. I'm just giving a simple example, but there are many situations. To the many situations, the stress response is the same, but in a subtle way, or it may be the intensity of the response will differ according to the situation. But all this happens with each of our situations in the life. Okay, I just explained this. I just want to skip these slides because we have many things to cover. Whenever, I'll just say, if any situations comes, we will be having two options. That is either fight with the situation, either you fight with the snake, or you will flight, or you will run away. So there are only two responses that we can do: fight or flight. Okay, so this is how. So external demanding situations, like what I shared, like finance, pollution, all these things, and internal demanding situations like lots of ambition, overconfident, poor self-esteem, dealing with your goal, dealing with your mindset. Those are all internal demanding situation. When external demanding situation and the internal demanding situations, so they are all want a response from your body, right? That's how it hit the multiple system at the same time. So I had just given small example of catching a bus, but there are many situations through which you are dealing. Maybe if you are working mother, you may be dealing with how to balance work and life, guilt tour about your kids care. If you're a man, you might be dealing with like how to exchange a conversation between my boss. How can I complete my deadline? So every person's snake or a situation is different. But how and most important thing is, if you are living, that means the situations comes to you. It's not like that it is going to end. Like student is also having who is graduating, he is also having some of the other situations, demanding situations. So even if you get married, even if you got a dream job, even if you get all the things in your life, still the situation will never end. That you need to understand. Also, you need to make the patients to understand, like situations are going to come. It's coming to me, that means that is coming to you also. So if you understand that point, then the management becomes so easy. We can just, once you understand that, okay, this situation is never going to end. I am responsible for my reaction. I am responsible for my thoughts, my reaction, and my happiness. If you take in that responsibility first, then it's very easy to manage. If you convince this point to your client, then it becomes very easy to deal with the diseases. Because most of lifestyle disorder or a psychosomatic disorder, the origin is this. So origin is the stress. If you put the super duper medicines for your PCOD, and you give a good cardiac activity, but the patient is not recovering, or patient is recovering for a time being, again the PCOD is relapsing, or autoimmune disorders like psoriasis extra relapsing. That means somewhere some other thing is also responsible, that you are not touching the stress part of the patient. Like if you don't address the source of the stress, and if you don't give a coping strategy to your client, the situation may recur. So even though you are giving a very good medicine appropriate to the Prakriti, Dosha, Avastha, Sthana, everything, but if the stress is not reduced, if the patient is not sleeping on time, if the patient is not taking food on time, then definitely it is going to recur. So it's addressing the stress is very important in each and every psychosomatic disorder. So what happens? Okay, we understood what is stress. We understood what exactly happens, the physiological changes, what happens. But now we'll go deep into what the pathological changes that happens in the body when it goes unchecked, when we don't understand ourselves, when we don't do a swadhyaya of ourselves, where we are in the situation, then definitely it is going to affect our system in a long run. Like when the fight and the flight response continues unchecked during the times of a chronic stress, then it is going to affect the corticosteroids. That means glucocorticoids are, okay, I'll just explain with this slide. It's hypothalamo-pituitary adrenal axis. HPA axis will start up. The normal circadian rhythm will be affected. So the stress circadian rhythm will activate. Thereby, it activates the ACTH of the adrenal gland. So that's how the glucose, which is readily glucocorticoids, starts up the gluconeogenesis. Thereby, we get a glucose for our fight or flight response. So when the flight or fight response is activated, then what happens? Our immune system becomes altered, and the net loss of amino acids starts up, and the deamination of the proteins into amino acids, because we need a glucose readily. Then the liver will also get affected in the long run. Then that's why we notice lots of fatty liver cases nowadays, and free fatty acid mobilization will start, and the heart rate increases. So these are short-term consequences when this response, when the stress recording rhythm is again and again and again, when we do this, then what happens? These are the short-term consequences that we notice in our patients. Sleep disturbances, back, shoulder or neck pain, tension and migraine headaches, upset. Yeah, you might be notice all the symptoms in your patients, but we generalize it, like telling them, "We don't take stress, please." So when we just generalize this statement, what happens? It's stress will not be addressed. The patient thinks, "What you know about us?" You just can say like, "Don't take stress," but you don't know about that. Mismatch will start up and will not get a result that we actually need from the patient. So addressing it and bifurcating whether it is absolutely with stress origin, or it is exactly related to the other situation, other causes, that bifurcation we need to make. So this is the first phase when the body's response to the stress. That is, first is alarm phase, resistance phase, and the exhaustion phase. These are the three phases that every patient goes through: alarm, resistance, and the exhaustion phase. Alarm phase is the first response, resistance phase is the second, and exhaustion is the third stage that we can say. First is alarm reaction, second resistance, third is exhaustion. So in alarm phase, what happens? Region of the brain responsible for the higher mental function interrupts the nature of the event, and sympathetic nervous system is triggered. Hypothalamus interrupts the body's needs for the more energy and triggers the pituitary gland to release the ACTH. And ACTH acts on the adrenal gland to release the stress hormone, cortisol, epinephrine, and the norepinephrine. And these stress hormones trigger the muscles and the liver to release a glycogen into glucose. So this all we understood. The body's resources have to be prioritized. The activities of the body that are important but are not urgent are put on hold, such as a digestion. That's why the first system to be affected in stress is. Next is a resistance phase, when the body is actively trying to reverse these actions that transpired during the alarm phase, and during the resistance phase of the body, under control of the parasympathetic system. Like parasympathetic starts trying to control the situation. It tries to slow down your heart rate, try to give the suggestions to the spleen and the blood through the switching on to the normal circadian rhythm rather than the stress circadian rhythm. The nervous system actively participate to bring it back to the normalcy. But when we don't notice it, or when we overuse, or when we avoid, or see, if you know that my hyperacidity is due to the lack of sleep, but if the hyperacidity is due to the stress, but if you don't notice it, and if you pop the pill for hyperacidity, but that means you are just temporarily subsiding the system, then, but it is long run, it is going to affect you with any problems. So the same with happens the resistance phase. If you don't address in the resistance phase, then the exhaustion phase is going to. Long-term exposure to a stressors can result in overload, and the body is overtaxed. There are no recovery periods, and illness can result. This is a depleted state that has been the result of an ineffective balance of alarm phase and the resistance phase. So this is a picture that I want to give. This is the first response that we get, and if you adopt some coping strategies, that relaxation, walking, jogging, or your favorite play or your favorite craft. If you don't do that, if you don't adopt any one of the coping strategies, then what happens? You will land up in the exhaustion phase. That means a disease breakdown or a mental breakdown. So it's very important first analyze us where we are. That's why I shared that form. See, if you're scoring in between, so total score is 40. That what the form is there. So if you're scoring in between a 10 to 20, that means you're just in a first phase, that is fight or a flight. Or if you are in scoring in between a 20 to 30, that means you are trying to recover yourself, but you need to work hard towards still you reverse your score to the zero. And if you are scoring above 30, that means you need a serious coping strategies. You need a one-to-one consultation with your healthcare provider, and you need to seriously go through all those things for a really long term, so that all your physiological and pathological changes come to the normalcy and you can reverse the disease. Okay, emotional signs of symptoms are that we notice: depression, mood swings, memory problem, irritability, frustration that we all notice in our patients, feeling out of control, and substance abuse starts from this. Next is a relaxation response. Herbert Benson suggests that you can use your mind to change your physiology for the better, improving your health and perhaps reducing your need for the medication. He coined the term the relaxation response to refer this natural restorative process. So sleep is one of the phase where we every day we undergo this restorative process. So far we understood like what is stress, sources, and how it is going to affect our physiology, and how long run when we don't check the stress, what is going to happen. So somebody says the reaction to the situation. The situations are inevitable. Situations are going to come with our life, with different situations, with a different age, with a different mindset, with a different ambition. We will come across many things. So what to do? Like usually our performance peaks when the stress level peaks, as just before the exam or just before finishing your deadlines. Our performance peaks at that time. But how many times it peaks, or how many times your body can cope up to give that boost of work for you? So what we can do then? Because without a stress, without a demanding situation, without a gamification of our life, it will be boring to do. So what we can do to cope up, and what are the coping strategies that we can adopt or that we can tell our patients to adopt, so that we can better handle our patients and give a quick result and lead them towards a symptom-free and a medicine-free life. We always think about symptom-free, but we need to concentrate more on the medicine-free part also. So when we manage the stress effectively, then automatically we can make a patient medicine-free. So these are eustress, and the distress. There are three types of stress that are explained. Like running for the bus, running to catch the bus is a eustress. That means you need to catch your bus. Definitely, you can't miss it. So you're running for that situation. That is a eustress. But you're repeating the same mistake every day. Like you're getting up late, you're not keeping alarm, and you're keeping only 5 minutes to go to the bus stand. You're doing this again and again and again. That you land up your eustress into the distress mood. Like when unexplained situation comes, and reacting to that situation for one time is absolutely fine. When we repeat the same mistake and again and unnoticed, then what happens? It is land up in the distress. So prioritizing the situations and your response is the first step in the coping strategies. So all of you with me till now, okay, these are the 10 principles of stress management. So that's what I really recommend to the patients. But all are not needed for every patient. You can tailor-made these management for your patients. If it is just started, you can just give one or two strategies to manage the stress. If the patient is suffering too much of anxiety, depression, then you can give more than 3 or 4 strategies, and so that we can maintain everything. I will roughly go through it. First one is breathing. What you know about the breathing? Whether ever you've noticed your emotions and your breathing are interconnected. Whether ever you noticed it, every emotion has its own breathing pattern. Yes, stress is a heavy breathing. Every breathing has, or every emotion has its own breathing pattern. Like anger, you might have noticed. Yes, definitely breathing balances the body and mind. Very nice thing. Every emotion. Anger is having a fast breathing. When you are relaxed, you will be doing a slow breathing. Depression, breathing with irregular rhythm. You are excited, that means your breathing is fast, but the rhythmic. And if I can say anxiety, irregular rhythm, but it's a high rate. Breathing rate is high, but it's irregular rhythm. So every emotion has its own breathing pattern. Most of the time, we are not able to control our emotions because emotion is a bundle of thoughts. When we repeat one thought for 100 times or 50 times, that becomes an emotion. Okay, so cut down our emotion. It's very big task. For a quickly we can't disseminate or dissolve the emotion. That's why. But the key to change your emotion is a breathing. The beauty of controlling your emotion is if you do a slow, rhythmic, and abdominal breathing. You might be knowing this. That's the simplest solution to control your emotion quickly. Can all of you do with me the slow abdominal breathing, just keeping your right hand on your abdomen, keeping your straight, correcting your posture, like rotating your shoulder outer blade, like just rotate your shoulder and keep your back straight and keep your right hand on the abdomen and simply take 30 seconds of slow abdominal breathing. So what's your emotion? You are, I think, absolutely, at least you might have your energies which are cluttered. This is pounding of your energy instantly. If you tell the patient that just observe your breathing and observe your breathing 10 times a day in a different situation, just before your meal, just talking before your husband, just talking before you talking with the kids or your boss, just observe your breathing and go for a situation. If you tell that, that itself solves the many of your problem, patient's problem. Second is you can give a breathing exercises. So there are many breathing exercises that are very easily available. Hands in and out breathing, hand stretch breathing. Many of cases, whenever the anxiety and depression case comes to me, first thing what I do is, because sometimes they do open up their problems, sometimes they don't open up. The first thing what I do is I'll tell my teacher to teach first a breathing exercise. Once they learn the breathing exercise, there's will be combed, energy channels will be combed, then I'll talk to them, see what happened to you. So that's how it starts. So first one is that. Second is progressive relaxation technique. Next is meditation, self-hypnosis, thought stopping, worry control, coping skill training, goal setting and time management, job stress management, nutrition, and yoga. These are the 10 coping skills. See, understanding the patient's problem, whether the patient is overthinking, whether the patient is having a less source in his job, whether the patient is struggling with the time management, whether the patient is not having an adequate nutrition, the patient is not able to control the worry. You need to pinpoint your stress and give the specific management to particular to your client. That is more important rather than generalizing the stress management skills. So because all the patients can't do all the things. So breathing is first basic thing that you need to keep for every patient. And after that, the next coping, so next adopt one or two other techniques, basically specifically important for your client that you can go through. Selection of the technique, symptom effectiveness, and time to master. So once you teach the specific technique, then you need to monitor it, like before and after that. How you will monitor them? You can check with their heart rate, breathing rate, and you can check with their symptoms, other symptoms, and the sleep pattern, and panic attacks, anxiety attacks. You can score before and after, then you can judge them according to the symptom effectiveness. And time to master. So consistency is the key. The minimum, each of the technique, the minimum they need to follow at least for 21 days. Then only you'll get some result in that. 1 or 2 days, they'll feel better. Once they stop, then again it will recover. They need to at least they need to master for 21 days. So as I told, body awareness, Swadhyaya is a must, is the first step towards acknowledging and reducing stress. So first, we need to understand, am I passing my stool right away when I get up? When I get up, and without any chai, without any hot water, I'm passing stool. And I'm very fresh in the morning. When I get up, I don't have any baggage, or my head is not heavy, and I'm fully enthusiastic to do my work. And I don't have any mood swing in the evening. Like I'm not agitated, frustrated, or my self-esteem is not low in the evening, and I'm getting a good appetite. It's not a craving, it's an appetite. And on time, like 8:30, 1:30, 7:30, like breakfast, lunch, and dinner. And these are a rule of thumb to check your stress level. And night, I'm getting a sleep. When I go to a bed, I'm just sleeping in ziffy, like within 30 seconds, 1 minute, I'm sleeping without any assistance. That means you're like, it's a one way to assess your stress, like 5 things that I told. If any of the one thing is disturbed, that means you are putting yourself, I'm using you, sorry, but it's you refers to your patients, don't misunderstand. And if you sit in the bathroom for more than 10 minutes, it might not be just a cruel coaster, like cruel coaster source भी हमें ढूंढना है. And the cruel coast की source को हमें पकड़ के थोड़ा ये techniques को add करेंगे, then Anuloma DS and the stress management technique together will work wonder. And all stimulation to the 5 senses from the outside world and internal awareness, any physical sensation, feeling, emotional discomfort, or a comfort inside our body, that all things that you need to. This is another one technique that I use. Focus your attention on the outside world in the sense job, family, or workspace, environment, everything, and shift your attention to your body and the physical sensations, like how you're responding to your outside world from inside, how the body is responding, how your physical sensation. What is a funny example with you? What will be your mood swing, or what will be your things when you go to mother-in-law's house? आप अगर ससुराल जाना है तो आपका क्या ये रहता है? And when we want to go to your parents' house, so what are the changes that happen in your body? That's a perfect example for the things. हम outside world के साथ कैसे हमारे inside world कैसे respond करेंगे? Settle back forth between the internal and the external awareness. What is the situation outside? How my body is responding. What is the situation outside? How I'm responding. This is a Gestalt exercise. So wonderful exercise to do the Swadhyaya. How we can do the Swadhyaya is the best exercise. Repeat number of times a day. This exercise allows you separate and appreciate the real difference between inner and the outer worlds. It's very important that when you understand this point, then you'll understand stress comes from me and I am responsible for my thoughts and my actions and my happiness. वो responsibility ये Gestalt exercises से easy आ जाएगा. Once you understand that, it's very easy to alter your response because response is all yours. So you are making every day. Body scanning. Okay. So once you observe your body, discover the tense area. It might be a neck muscle, it might be a lower back, it might be anything that or your calf muscles. If अगर आपकी patient stressful है कि नहीं, वो जानने के लिए, just to quick analysis if you want to do. If many patients don't open up, keep I'm having a stress. First, just touch the calf muscles of the patient, as a part of your examination. If the calf muscles is too tight, that means a patient is in stress. This is a direct indication of a stress. Even you can touch your calf muscles now and observe how soft it is and how tight it is. So that will give you a bare calculation of your stress. What you could do to change it? Okay, when you analyze if your neck muscles are tensed, your lower back is tense, and I'm reacting in that way for each of my situations, then I can change it. Am I capable of changing this? So if you do that, okay, I want to change myself. I want to react in a different way. I want to react to the situation in a very calm and peaceful way. I don't want my body to get affected by this. This complete the Gestalt exercise. Internal and external and internal focus, body scanning, and letting go. So these are 3 steps that you can give it to your client. Or you can just simply record a voice message and send to them to do this exercise. So that also works nice. Stress awareness diary that you can tell your patients to check how many times you are reacting in a different way to your different demanding situation. And you can recommend any relaxation exercise so that the patient will come to know that relaxation exercise really works for me. So to record before and after is necessary so that the patient will realize that relaxation exercise is really benefiting me, that I need to continue for a minimum 21 days. Breathing that we discussed, deep breathing helps, and the deep progressive relaxation technique that you will get it in the net. Each muscle group from head to toe, you need to just scan your body, tighten your tense your muscles for 5 to 7 seconds and release them for 20 to 30 seconds. Group of muscles like from head to toe, and let go the tension, calm and rested. Each and every muscles like foot, calf muscle, thigh muscles, like individual group muscles, you'll tense it, you'll release it. You'll tense it, you'll release it. And when you do it on a repeatedly, then it gives a wonderful relaxation to your client. So at least 1 or 2 weeks is must. 15 minutes session. The progressive muscular relaxation technique hardly gives you 15 minutes per day. If you practice this, you will get a very good result. If you PV Sindhu, she mentioned like I practice the progressive muscular relaxation technique to let go my tensions in my body and my emotional body. So she mentioned about this technique that she follows to make herself fit. Next is meditation part. You might be knowing it. Meditation. See, how many of you know about the meditation? I just want to give a quick clarity in one line. Meditation, we can't do meditation. Meditation happens. That means dharana, dhyana, samadhi. Dharana we can do. That's like we are doing. That's a karma. Once we go on doing dharana, dhyana happens. Dhyana is not something that we can do. It's not a karma that we do. It automatically happens. So जब हम worship करते हैं, that's also a dharana, but it's not a ध्यान. So धारण में subject and the object दोनों रहेंगे. ध्यान में only object रहता है, and samadhi में, in samadhi nothing will be there. Subject and object and nothing. So going towards the nothingness, avyakta is a samadhi. So this is a stage that we do. But first you tell your patients to do the dharana so that they can go slowly into a meditative phase. One tip: don't give a meditation for a depression patient. Don't advise a meditation for a depression case, because meditation is a repeating the same thought. So if you tell the depression patient to meditate, that means repeating one thought or on a single object. They may repeat on their negative thoughts only. They may meditate on negative thoughts. So initial period में don't tell them, whenever in general what we say, okay, depression है, so थोड़ा meditation किया करो. We tell that, but don't give them a cardio exercises followed by the progressive muscular relaxation, rather than telling them to close the eyes and meditate. 3 basic meditation: mantra meditation, sitting, and breathing counting meditation. These are a simple meditation that we can adopt. Mindfulness and present moment awareness. So, and eating meditation, walking meditation. So these are all mindfulness technique. When we are conscious about each and everything that we do from morning to night, that gives a lots of benefits. It's not just only to stress reduction. It's helpful for our growth and the productivity in our career and in our family. It gives us a emotional attachment with our family. Nowadays, we are physically present but emotionally detached from our kids. We are feeding a good food, but emotional connection is not there with the kids and the spouse. So it's very important, being mindful, being in a present moment, not just thinking about the memories and the past things, not just planning about every day about the future. Being in a present moment, consciousness and mindfulness about every day what you are doing, it's just changes you. And before scolding someone, before letting out your frustration, you will be much aware of, like, when you practice this, that will not happen. So next is job stress management. This is a very big topic in the same, like if any of your client is suffering with job stress, then I suggest you need to give a job stress management questionnaire, so that whether which area, in which area the job is stressful, whether you are not able to control, you have an information gap, that's why you are getting stress, or you are cause and effect. Some changes in the policy that is giving you a stress, or a conflict between your own inner self and what you are doing job. Like somebody want to do the play badminton, but if you are giving a desk job, there the conflict occurs. So you need to understand in which area the patient is stressful in job also. Then it helps you clear the block in the job stress. Then you can able to give a strategy. Blocked career, that means there is no growth, and overloaded, underload. Sometimes in a government job, there is nothing to do. That also makes them people to feel stressed. And the environment, everything is okay, but toxic IT sector is making more stressful. That means you need to work on it, how you can do. And value conflict, that means you have a high values, like I don't want to cheat, I don't want to steal, but your job is like something like you are doing, that also gives you a stress. So when you need to identify your patient's job stressor and feelings, how the patient is reacting, how his thoughts, and how is his behavior. So when he identifies it, then it becomes very easy to change the external stressor, change your thoughts, change physical. This is how we can respond. Okay, goal setting, it's a very everyone talks about it, so I just don't want to do this. Yeah, this is very important. Good stress reducer, humor, we are missing that in our life. Relieves muscular tension, pumps the endorphins into the bloodstream. Just I want you to recall when you laughed last time to full stomach. मतलब आप पेट भर के कब हंसा था last time? Nowadays, people laugh at only Kapil Sharma show. Other than that, people don't laugh. So, but I want just do at least once with your kids in the everyday situation. Ask them what is happening at your school, and you can laugh together for any silly situation. You know that makes the environment light, and your kids also feels comfortable. Okay, mommy is also silly. You know, she's not so serious. How you see change lifestyle management. So what are the things that major covers in the lifestyle? Nowadays, the lifestyle coaches are more. So they talk about Ayurveda. They are completely, sometimes very good life coach gives a very good information about Ayurveda. But most of the times I am seeing in Instagram and Facebook, it's like overused or wrongly used about Ayurveda. So just I think Ayurveda people has to now talk about Ayurveda. Then I think other people will stop talking so that it can be conveyed to the general public in a proper manner. First and foremost, diet, exercise, and the sleep. So these three things comes under the lifestyle changes. So diet, Prakriti-based diet. So seasonal, traditional food, seasonal, traditional, Prakriti-based food. Exercise 45 minutes. That's what I recommend, or 4 days a week, definitely. And sleep, you all know 6 to 7 hours of sleep, but the quality of sleep also you need to check with the patient. You can give coping strategies like Bhramari, Yoga Nidra, and applying oil on the foot, and checking their thought throughout the day, and stress management diary. That will helps for the cope up with the sleep along with our Shirodhara and other medicines. Yeah, this is a takeaway message. Rest, relax, and sleep. So sleep is the one that we are compromising every day. If you're going trip, sleep is compromised. If you have a meeting, sleep. If you want to watch a TV, if you want to anything, the sleep is something we always nowadays we give importance to the nutrition, like protein, yes, everything is more in hype. But sleep is something that everyone is missing. So just give importance to the sleep. It's very, 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 very needed for us also and our patients also. So with this thought, I want to conclude my session. Is a pill dissolving in your stomach more effective than a healing thought dissolving in your mind? Which one is more effective? We need to ponder on this. Sometimes we just need a 20% of mindset, 20% of a skill set, 80% of the mindset. So to make a mindset, if you want to, you made your mind like I want to prepare a biryani today, it becomes very easy. Like you in 20 minutes. But if you want to do, like you prepare for upma, if someone tells you to do the biryani, even though you have a skill of both, it becomes very hard for you to prepare a biryani when you are in a mindset of a upma. So work on yourself on an everyday basis. It's very, very important. Like we need to prepare ourselves. It's not just for a patients, for us. Thank you so much, sir, for this wonderful opportunity.
Thank you, madam, for a mind-opening session on stress and various aspects of it. Thank you, everyone. Thank you, Dr. Rashmi.
Thank you, sir.
See you in the next session. Namaste.